The new numbers are based on what UW researchers call a massive infusion of new data. They show the number of deaths due to coronavirus peaking in Washington today, then falling off. But across the nation, it's an entirely different story.
This is going to have a quite profound effect on mortality, leading to, our best estimate is about 81,000 deaths, and it could be much higher depending on other circumstances.
That was the prediction last month from the head of UW's Institute for Health Metrics and Evaluation. The latest modeling shows his nationwide forecast largely holding firm today. Roughly 82,000 deaths from coronavirus are now expected nationwide, with 10 days until a projected peak in daily deaths. April 16th is when 3,130 coronavirus deaths are expected across the country. In Washington, the numbers are not nearly as dire. They show a state that has largely flattened the curve. Coronavirus deaths in Washington are expected to peak today with 19 deaths. The projected statewide death toll, 632 by early August, a drastic drop from earlier projections of as many as 1,400 deaths. But Dr. Murray said in a statement there is a catch, and it applies to residents of Washington as well. If social distancing measures are relaxed or not implemented, the U.S. will see greater death tolls. The death peak will be later, the burden on hospitals will be much greater, and the economic costs will continue to grow.
There is also good news for Washington in terms of medical supplies and hospital beds. Those new numbers show there will be no shortage expected for hospital beds or ventilators. Kristen Ayers, King 5 News.